Hypoplastic left heart syndrome is a birth defect that affects normal blood flow through the heart. As the baby develops during pregnancy, the left side of the heart, including the mitral valve, left ventricle, aortic valve, ascending aorta and aorticarch, does not form correctly. The left side of the heart is extremely underdeveloped. Hypoplastic left heart syndrome is one type of congenital heart defect. Congenital means present at birth. Because a baby with this defect needs surgery or other procedures soon after birth, hypoplastic left heart syndrome is considered a critical congenital heart defect. Hypoplastic left heart syndrome affects a number of structures on the left side of the heart that do not fully develop. The left side of the heart can't pump blood well. For example, the left ventricle is underdeveloped and too small. The mitral valves is not formed or is very small. The aortic valve is not formed or is very small. The ascending portion of the aorta is underdeveloped or is too small. Often, babies with hypoplastic left heart syndrome also have an atrial septal defect, which is a hole between the left and right upper chambers, atria, of the heart. In a baby without a congenital heart defect, the right side of the heart pumps oxygen-poor blood from the heart to the lungs. The left side of the heart pumps oxygen-rich blood to the rest of the body. When a baby is growing in a mother's womb during pregnancy, there are two small openings between the left and right sides of the heart. The patent ductus arteriosus (PDA) is a blood vessel that connects the pulmonary artery to the aorta, allowing blood to continue circulating directly into the aorta and out to the rest of the body, bypassing the lungs and the defective left side of the heart and the patent foramen ovale. Normally, these openings will close a few days after birth. In babies with hypoplastic left heart syndrome, the left side of the heart cannot pump oxygen-rich blood to the body properly. During the first few days of life for a baby with hypoplastic left heart syndrome, the oxygen-rich blood bypasses the poorly functioning left side of the heart through the patent ductus arteriosus and the patent foramen ovale. The right side of the heart then pumps blood to both the lungs and the rest of the body. However, among babies with hypoplastic left heart syndrome, once the PDA closes a few days after birth, blood flows to the lungs and then to the left side of the heart, where it is blocked and can't circulate through the rest of the body. It becomes hard for oxygen-rich blood to get to the rest of the body. Most infants die within the first 2 weeks of life. Some patients with hypoplastic left heart syndrome, however, can survive beyond 60 days without any surgical intervention through the development of pulmonary hypertension. Women can take steps before and during pregnancy to reduce the risk of having a baby born with birth defects. Such steps include taking a daily multivitamin with folic acid, 400 micrograms, not smoking, and not drinking alcohol during pregnancy. Treatment of hypoplastic left heart syndrome requires medication. A continuous infusion of prostaglandin E1 (PGE1) is needed to maintain ductal patency. To prevent closure of the connection ductus arteriosus between the right and left sides of the heart. Plus, either surgery or a heart transplant is necessary. Advances in care have improved the outlook for babies born with this condition. Symptoms: babies born with hypoplastic left heart syndrome usually are seriously ill soon after birth. Symptoms include 1. Grayish-blue color of the lips and gums, cyanosis. 2. Rapid, difficult breathing. 3. Poor feeding. 4. Cold hands and feet. 4. Weak pulse. 5. Being unusually drowsy or inactive. If the natural connections between the heart's left and right sides, foramen ovale and ductus arteriosus, are allowed to close in the first few days of life in babies with hypoplastic left heart syndrome, they can go into shock and possibly die. Most babies with hypoplastic left heart syndrome are diagnosed either before birth or soon after. However, seek medical help if you notice that your baby has any of the symptoms of the condition. Hypoplastic left heart syndrome occurs in the womb when a baby's heart is developing. The cause is unknown. However, having one child with hypoplastic left heart syndrome increases the risk of having another with a similar condition. A diagnosis of hypoplastic left heart syndrome is confirmed with an echocardiogram. It shows a small left ventricle and aorta. The echocardiogram might also show issues with heart valves. Because this test can track blood flow, it shows blood moving from the right ventricle into the aorta. And an echocardiogram can also identify other heart conditions, such as an atrial septal defect. Please